Imagine this. It's just another day. Maybe you're at work, relaxing at home. The sun is shining, or perhaps it's a rainy afternoon. You're engrossed in your tasks, or maybe you're unwinding with a good book or your favorite TV show. Everything seems perfectly normal. Suddenly, a strange pain shoots down your arm. It's sharp, unexpected, and it catches you off guard. You try to shake it off, thinking it's just a muscle cramp or maybe you slept wrong. But then, you feel a tightness creeping across your chest, like something heavy pressing down. It's not just discomfort. It's a pressure that makes you pause, makes you wonder if something more serious is happening. Then there's the cold sweat, damp and unexpected, chilling your skin. It's not the kind of sweat you get from exercise or heat. It's different, more alarming. Your body is trying to tell you something. It passes, just as quickly as it came. The pain subsides, the tightness eases, and the sweat dries. You feel a wave of relief, thinking it was just a fleeting moment of discomfort. You shrug it off, thinking it's nothing, right? Maybe you even laugh at yourself for being worried. After all, you're healthy, you exercise, you eat well. It couldn't be anything serious. But here's the chilling reality. Every 40 seconds, someone has a heart attack. That's right, every 40 seconds. It's a statistic that's hard to ignore, and it's happening all around us, to people just like you. And many ignore the signs until it's too late. They dismiss the symptoms, thinking they're too young, too fit, too busy to be having a heart attack. But heart disease doesn't discriminate. What if this wasn't just nothing? What if these symptoms were the early warning signs of something much more serious? It's a sobering thought, but one that could save your life. What if these small, easy-to-miss signals were your body's silent cry for help? Your heart trying to tell you that something is wrong, that you need to pay attention. Knowing the early warning signs could mean the difference between life and death, your life or the life of someone you care about. It's not just about you, it's about your family, your friends, the people who love you. Today, we're breaking down the 7 critical symptoms of a heart attack, the subtle, easily missed clues your heart might be giving you. Don't ignore these signs. They could be the key to getting the help you need in time. Let's dive in and learn how to protect yourself and your loved ones. Understanding these symptoms, recognizing them when they happen, and knowing what to do could make all the difference. Stay with us, and let's get informed together. Let's start with the most common symptom of a heart attack, chest pain. This is often the first sign that something might be wrong with your heart. But this isn't always the Hollywood heart attack you see in the movies. In reality, heart attack symptoms can be much more subtle and varied. It's not always a sudden, debilitating pain. Sometimes it can be a mild discomfort that you might easily dismiss. Sometimes it's more of a pressure, a squeezing, or a feeling of fullness in the center or left side of your chest. This sensation can be confusing and might be mistaken for indigestion or heartburn. Some people describe it as an elephant sitting on their chest. This heavy, oppressive feeling can be very alarming and should not be ignored. This pain can last for several minutes, or it might come and go in waves. It's important to pay attention to these patterns and take note of any recurring discomfort. Now, not every chest pain means you're having a heart attack. There are many other conditions that can cause chest pain, such as muscle strain, acid reflux, or even anxiety. But if you experience intense chest pain out of the blue, especially if you've never felt it before, don't brush it off. This could be a sign of a serious problem. This could be your heart struggling to get the oxygen it needs. When the heart muscle doesn't get enough oxygen, it can cause severe pain and damage to the heart tissue. And that's a sign you need medical attention immediately. Quick response can make a significant difference in the outcome of a heart attack. Remember, time is muscle when it comes to heart attacks. The faster you get to the hospital, the better your chances of minimizing heart damage and improving recovery. If you or someone you know experiences these symptoms, don't hesitate to call emergency services. It's always better to be safe and get checked out by a professional. Early intervention can save lives and lead to better treatment outcomes. So, listen to your body and take action if something doesn't feel right. Taking care of your heart is crucial. Stay informed, stay vigilant, and don't ignore the warning signs. Your heart health is worth it. Here's something many people don't realize. Heart attack pain doesn't always stay confined to your chest. While chest pain is the most common symptom, it's not the only one you should be aware of. It can radiate to other parts of your body, like your arms, shoulders, neck, jaw, or even your back. This spreading of pain can often be confusing and misleading. This is called referred pain. And it happens because the nerves in your heart and other parts of your body are interconnected. The nervous system is a complex network that can sometimes send pain signals to areas far from the actual source of the problem. You see, your body isn't always great at pinpointing exactly where pain originates. This can make it difficult to identify the true cause of your discomfort. So a problem in your heart can actually be felt as pain in these other areas. This is why it's important to pay attention to any unusual pain or discomfort you might experience. This is especially common in women who often experience heart attack symptoms differently than men. Women are more likely to have symptoms like shortness of breath, nausea, and back or jaw pain. Don't dismiss pain in these areas as just a pulled muscle or something you ate. It's easy to overlook these symptoms, but doing so can be dangerous. If you feel an unusual pain radiating to your arms, back, or jaw, especially alongside chest discomfort, it's crucial to seek medical help right away. Early intervention can make a significant difference in the outcome of a heart attack. Remember, it's always better to be safe and get checked out by a medical professional if you're experiencing any of these symptoms. Time is of the essence when it comes to heart attacks. The sooner you get help, the better your chances of recovery. So don't hesitate to call for help if you suspect something is wrong. Being aware of these symptoms and understanding how heart attack pain can manifest in different parts of your body can save lives. Stay informed, stay vigilant, and take action if you need to. Ever find yourself suddenly gasping for air for no apparent reason? This is shortness of breath, and it can be another warning sign of a heart attack. When your heart isn't pumping blood effectively, fluid can build up in your lungs, making it difficult to breathe. This shortness of breath can come on suddenly, even if you're just sitting down or doing light activity. Now, shortness of breath can be caused by many things like asthma or a respiratory infection. But if you're experiencing it for the first time, or if it's unusually severe and accompanied by chest discomfort, don't hesitate to call for help. It's always better to err on the side of caution when it comes to your heart. You might be surprised to learn that some people experience nausea, indigestion, or stomach pain during a heart attack. These symptoms are often mistaken for something less serious, like food poisoning, the flu, or even just stress. This is especially true for women who are more likely to experience these less typical heart attack symptoms. So, why does this happen? Well, when your heart isn't getting enough blood flow, it can affect other organs, including your stomach. This can lead to feelings of nausea, indigestion, or a general uneasiness in your stomach. If you're experiencing these symptoms, and they're unusual for you, or accompanied by other symptoms like chest discomfort, don't ignore them. Chapter 5. Cold sweats. Have you ever broken out in a cold sweat even though you weren't hot or exercising? This can be another sign that something is wrong with your heart. When you're having a heart attack, your body goes into fight or flight mode. This triggers a surge of adrenaline, which can cause sudden cold sweats. You might feel clammy, your skin might feel cold and damp, and you might even feel lightheaded. If you're experiencing cold sweats without a clear reason, especially if they're accompanied by other heart attack symptoms, it's crucial to seek immediate medical attention. Chapter 6. Extreme fatigue. We all feel tired sometimes, but sudden unexplained fatigue can be a lesser-known symptom of a heart attack. This isn't just feeling a little sleepy. We're talking about a kind of exhaustion that comes on suddenly and makes even simple activities feel incredibly difficult. You might feel completely drained, even if you've had plenty of rest. This fatigue can occur days or even weeks before a heart attack, and it's more common in women. If you're experiencing unusual fatigue that's persistent and doesn't seem to have a cause, it's always a good idea to talk to your doctor. Chapter 7. Dizziness or lightheadedness. Dizziness or lightheadedness can occur during a heart attack if your blood pressure drops suddenly. This drop in blood pressure can reduce blood flow to your brain, making you feel faint or even causing you to pass out. This dizziness might make you feel unsteady on your feet, and you might feel like the room is spinning. If you experience sudden dizziness or lightheadedness, especially if it's accompanied by chest discomfort or trouble breathing, don't ignore it. It's crucial to seek immediate medical attention to determine the cause. We've covered a lot today, and I know it can be overwhelming. But remember, knowledge is power. Knowing the signs of a heart attack could save your life or the life of someone you love. If you or someone around you experiences any of these symptoms, especially in combination, call emergency services immediately. While you wait for help to arrive, stay calm and try to relax. If you have aspirin and aren't allergic, chew one regular strength tablet. This can help thin your blood and potentially improve blood flow to your heart. Remember, heart attacks are serious, but with awareness and quick action, lives can be saved. Share this video with your loved ones because you never know who might need this information.